A COVID survivor says it's a miracle he survived his battle with the coronavirus. That man is Craig Shaffer, and when he got sick, he was the administrator at the Newfane Rehab Nursing Home. The facility has had a tough time with COVID. State data shows 21 residents died from the virus. Another 7 resident deaths are classified as COVID presumed. Shaffer says the difference between life and death for him was a rarely used medical machine. With this 2 on Your Side original story is investigative reporter Steve Brown.
Would you be here today if it wasn't for that technology?
No, I would not be here.
Craig Shaffer credits this machine with saving his life. It is an ECMO, or extracorporeal membrane oxygenation machine.
Basically, it's a tool that we can use to help rest the lungs or the heart in the lungs and let the body heal on its own.
Dr. Harsh Jain would eventually treat Shaffer in this very South Buffalo Mercy hospital room. On April 25th, Shaffer would arrive here by ambulance after being horribly sick for a week. He tested positive for COVID and was immediately transferred to St. Joseph's Hospital, which had been reconfigured into a COVID-only facility. On arrival, Shaffer's blood pressure was spiking, his oxygen levels dangerously low.
They told me there's nothing else to save your life. You need to get on the vent now. Open your mouth. They had me in a separate room from the ICU. They wheeled me into there and it was lights out.
Being on a ventilator requires the patient to be heavily sedated, and that's how he stayed for weeks. Shaffer remembers almost none of it, including when his condition worsened and was transferred back to South Buffalo Mercy. Still on a ventilator, Shaffer was also hooked up to an ECMO machine. Is it the worst of the worst patients?
Yes, it is the worst of the worst. So when all the other options have been exhausted, is just to buy more time and give them a chance to try to recover.
The machine takes blood from a patient, filters out carbon dioxide, enriches it with oxygen, and returns it to the patient, bypassing the patient's heart and lungs.
He did improve initially, and then he kind of got to a point where he was stagnant.
On May 8th, the hospital contacted Shaffer's longtime girlfriend.
They had let me know the day before, on the 7th, that he was so critically ill there was nothing left they could do for him.
The hospital made special arrangements, bringing Solinsky into the COVID unit to visit Shaffer.
But when you're visiting there, are you thinking you're saying goodbye?
I never did. I thought I knew why they were calling me in. I knew
because they thought
there was there's nothing left they could do, yeah. But I didn't let myself go there. I stayed at a level of, no, he's pulling through.
And the following day, Shaffer started to slowly improve, the ECMO keeping him alive.
And that's what ultimately saved my life. And I was on that for 23 days. My lungs were filled with putting consistency mucus. So it was touch and go for a good while there.
Weeks later, Shaffer opened his eyes. It took a while for him to emerge from the fog of being unconscious for so long. During an iPad visit with his girlfriend, he asked what day it was and was told it was June 14th.
And I immediately, I cried my eyes out, Steve. It just hit me like a ton of bricks that I had been out for over a month and a half.
In the days that followed, Shaffer was filled in on his recovery story.
They told me essentially that the ECMO technology had saved my life because the ventilator wasn't supporting me.
These days, Shaffer is continuing his recovery at home with his girlfriend keeping tabs on him. After a spring spent in darkness, he's able to enjoy a little summer sun on the patio, thankful for the technology that sustained him and the care he received at St. Joe's and South Buffalo Mercy.
I will forever be grateful, and I look forward to the day I can thank them in person.
There is a ways to go for Shaffer to get fully back to health. He's always on oxygen 24 hours a day. There's some concern about whether or not his lungs have been damaged. He is, however, starting to put on weight. He lost 70 pounds while he was in the hospital. Now, Catholic Health tells us that the ECMO machine, 6 patients have been put on it, 4 have survived, including Shaffer. Outside South Buffalo Mercy Hospital, this is Steve Brown, Channel 2 News. Mary Alice, back to you.
An incredible story of survival and so well told. Thank you, Steve.